Imagine this: a woman goes in for a routine checkup, maybe just thinking she'll get a pap smear or some tests done. Suddenly the doctor says there seems to be a mass blocking your cervix. The room goes quiet, your heart skips a beat, a million thoughts rush through your head. Is it cancer? Am I going to be okay? What does this even mean? Today we are diving deep into one of the scariest but most important health questions. How dangerous is a tumor blocking the cervix? I'll break it down in simple terms: what it means, the type of tumors that can grow there, how they affect fertility, pregnancy, and overall health, and of course the treatment options available. If you or someone you know has ever faced this diagnosis, this video will help you understand what is happening inside the body and why it is so important to act fast. Let's start with the basic. The cervix is the narrow passage that connects the uterus, that's the womb, to the vagina. Think of it like the gatekeeper of the female reproductive system. It plays several critical roles. It allows menstrual blood to exit the uterus. It produces mucus that can either help or block sperm from entering depending on the menstrual cycle. During pregnancy, the cervix stays tight, closed to protect the baby, and only opens during labor. Now, when a tumor forms, it blocks this passage. It's like having a roadblock at the only exit or entrance of a very busy highway, and that's where the danger begins. What do we mean by tumor? The word tumor can be terrifying, but here's the thing: not all tumors are cancerous. Benign tumors, these are non-cancerous growths. Example includes fibroids or polyps. They can still cause big problem if they grow in the wrong place, like blocking the cervix. Malignant tumor, these are cancerous. Cervical cancer is one of the leading causes of cancer-related death in women, especially in countries where routine screening is not common. So when we say tumor blocking the cervix, it could mean either type. The level of danger depends heavily on whether the tumor is benign or malignant. Let's look at symptoms of tumor blocking the cervix. A tumor in this location can cause very noticeable change in the body. Some of the warning signs includes abdominal vaginal bleeding, bleeding between periods after sex or post-menopause. The second one is watery, bloody, or foul-smelling vaginal discharge. The third is pain during sex or pelvic pain. The fourth is difficulty conceiving because the cervix acts as a barrier. Then the fifth one is menstrual blood obstruction. If the tumor fully blocks the cervical canal, menstrual blood can't flow out properly, causing severe pain and swelling inside the uterus, a condition called hematometra. The sixth is urinary or bowel issues. When the tumor grows large enough, it presses on nearby organs. These symptoms should never be ignored. Unfortunately, many women dismiss them as normal period problems. Now let's look at how dangerous is it really. Now the big question: a tumor blocking the cervix is dangerous for several reasons. The first is obstruction of blood flow and fertility issues. If menstrual blood can't leave the uterus, it can cause infections, pain, and even damage reproductive organs. Women may face infertility or complications trying to get pregnant. Two is pregnancy complications. If a tumor blocks the cervix during pregnancy, it may prevent normal labor. In severe cases, it can cause miscarriage, preterm birth, or the need for a C-section. Third is infection risk. A blocked cervix can trap bacteria inside, leading to pelvic infections or abscesses. Fourth is cancer risk. If the tumor is malignant, the danger skyrockets. Cervical cancer can spread to the uterus, bladder, rectum, and even distant organs without treatment. advanced cervical cancer is life-threatening. In short, whether benign or malignant, a tumor blocking the cervix is never something to ignore. So now let's look at the causes and risk factors. So why do tumor develop here? Human papillomavirus, HPV infection, the number one cause of cervical cancer. Hormonal imbalance, which can lead to benign growths like polyps. Genetics, family history increases risk. Another one is smoking, linked strongly to cervical cancer. Multiple pregnancies associated with higher cervical cancer risk. Weakened immune system makes it easier for abnormal cells to grow. Understanding this factor help with prevention and early detection. Now let's look at the diagnosis. How do doctors find it? Doctors use several methods to diagnose a tumor in the cervix. The first is pelvic exam, the first step where a doctor feels for unusual growth. Pap smear checks for abnormal cervical cells. HPV testing detects the virus link to cervical cancer. Ultrasound or MRI to see how big the tumor is and whether it's blocking the cervix. Biopsy, taking a tissue sample to confirm if the tumor is benign or malignant. Now let's look at the treatment option. Treatments depends on the type, size and severity of the tumor. For benign tumor, surgical removal. Doctors can remove cervical polyps or fibroids, laser or cryotherapy to destroy abnormal tissue. Monitoring if the tumor is small or not causing problems. For malignant tumor, cervical cancer, surgery may include removing part of the cervix or the whole uterus. Radiation therapy uses high energy beams to kill cancer cells. Chemotherapy, drugs that target cancer throughout the body. Then targeted therapy, immunotherapy, newer treatments that help the body fight cancer more effectively. The good news, if detected early, cervical cancer is highly treatable. Let's look at preventions and early detection. The best way to protect yourself is through prevention and routine screening. The first is HPV vaccination, highly effective in preventing the type of HPV that cause most cervical cancers. 2 is regular pap smear, starting from age 21 or earlier if sexually active. 3 is HPV testing, often combined with pap smear. 4 is safe sex practice, using condoms lowers HPV transmission risk. 5 is quit smoking, reduces risk of cervical or other cancers. This simple step can literally save lives. For women diagnosed with a cervical tumor, life changes dramatically. Emotional impact, fear, anxiety, and depression are common. Fertility concern, some treatments may affect the ability to have children. Regular follow-ups, it is very important to prevent recurrence. Support systems, counseling, family and survival growth can help. Survivors often say that early diagnosis and having a strong support network made all the difference. So how dangerous is a tumor blocking the cervix? The truth is, it can be very dangerous, whether it is a benign growth causing physical blockage or a malignant tumor signaling cervical cancer. The impact on a woman's health, fertility and life can be devastating if ignored. But here is the silver lining. With early detection, prevention through HPV vaccination and proper treatment, thousands of lives are saved every single year. If you have noticed abnormal bleeding, unusual discharge or pain that doesn't go away, don't ignore. Speak to a healthcare professional immediately. Remember, knowledge and action are your best weapons against cervical disease. Stay informed, stay healthy and protect yourself, okay? So if you find this video helpful, don't forget to like, share and subscribe, and I'll see you in the next one. Bye.